Hello, Eleanor. Thank you for giving up your valuable time. I'm going to skip the formalities. I'm going to do that. I feel like I've spoken to you enough times now, but just for the purpose of the people that may be listening or watching this, I know you're going to talk much about what you do, but be really interested to hear about where your general interest in mental health, body image, and dermatology came from.
Gosh, it's been a journey. Yeah. I mean, we've talked about this before, but I guess I came in to clinical psychology from an unusual route. I had a career change in my early 30s. I actually worked as a publishing editor, but I felt like I was just sat behind a desk and I wasn't seeing people. So yeah, I went back to school and did a psychology degree, and I did a doctoral degree as a clinical psychologist. So that's what I do now. But I've been particularly drawn to supporting people with body image problems. I've worked with people with eating disorders as part of my training. I've particularly worked with young people and adolescents. But more recently, I've got very interested in something we call psychodermatology, which is a technical gobbledygook label, but really it means people with skin conditions, understanding what that actually does, to their whole life, their mental health, their well-being, their nutrition, their physical health, their social life, like their whole being, basically. And that interest came from basically kind of going all through my teenage years with really severe acne and having quite bad acne scarring and more recently developing rosacea. And I just realize we're not good at supporting people with physical health conditions where that condition has an impact on their well-being and mental health. And it's something we talked about in our last chat, this idea that we kind of treat the body and the mind completely separately, and that just doesn't make any sense. So yeah, that's where I'm coming from.
Yeah, and it really fascinates me actually, because I think when we talk about these things, and it feels very apt because we're on the run up to Easter at the moment, and the sun is beginning to make an appearance. And certainly a lot of the messaging that I see is this emergence of the sun means more visible flesh on display, which means there's a lot of messaging around, I guess, for want of a better phrase, leveraging people's pain, reminding them of everything they're unhappy about, especially with regards to their appearance, and how potentially people have the answers when it comes to fixing their mindset, leading an amazing life full of confidence and building their self-esteem, which is largely around the body. So body transformations, and I guess diet culture are such foundational part of my industry. And I think when you speak about mental health there and skin conditions, I think everyone can resonate with how it just affects everyone's quality of life to a different extent. There's that mold, I guess, almost in air quotations, normal body dissatisfaction most people face. So they'll be body conscious on a day. They might want to put on some baggy clothing just to feel a bit more comfortable, or they're going swimming, or they're going on holiday, and all of a sudden their body becomes a focus, to the extent, I guess, some of the people that you may work with, where it's, they can't leave the house without covering certain parts of their body up, that it's debilitating quality of life, that it's, affecting the intimacy with their partner, and all these other things, I think, potentially extremes that people don't think about if you've never been there. So I guess for me, I'd really like to start with just your general opinion on the health and fitness space, because I know you have a vested
Well,
interest.
that's huge. That is a
But
huge question.
specifically to do with transformation pictures. Now,
Yeah.
I'm not going to push my biases on you too much, but I think for me, there is a fine line between inspiration, desperation, and intimidation in the space. And I think everyone will have their own, there's an individuality there, that everyone has their own opinion on that and how being subjected to all those images affects them. I just wanted to get your thoughts around that, if that's
Oh
okay.
God, it's such a tricky. So body transformations, it feels like it's kind of hardwired, right? That we look for the before and after, and that we it's quite. Even though my view is I think they're pretty toxic, but there's something about them that's just satisfying. I think just we find them satisfying to look at. I think we're drawn to resolution, and it's like, oh yeah, and we're so visually driven as well. I think
It's
I
almost like
think
an
what we're not
underdog story, isn't it? I think that's
yeah.
part of
But
the.
what we're not good at doing is, because everything is, especially with the way social media is currently, it's not it's not targeted at people, right? So if you've created a before and after picture, you can't control who sees that image. So yes, it could be seen by someone who would like some motivation and they would generally find that helpful. Give them that little push they may need, to become a bit more active. But that photo could easily be seen by someone who's already got a very poor body image and is very vulnerable. And actually their internal image of their own body is becoming more distorted and it's unachievable. And then they're being pushed these images of, what they sort of see as perfected bodies, and that's what they're trying to achieve. Maybe, and I'm interested in what you think about this. Some people just don't have the physique where they can match what they may see in a model, right? So, I'm guessing there's only, like, when you work with people, do you try and help them to manage their expectations? If someone like brings you a picture of someone who's like really buff, but they're say quite slender build, like a guy, would you say actually is that like doable for your kind of physique and your genetics?
Yeah, for me, it's certainly getting to the root cause actually for, that individual initially. It's like, is that aligned with their personal values? These are some of the things that might going through this process might entail. This is how long it's likely to take as well, because I think the reductionist view, we have a lot of these, especially 12-week body transformations, is that they have a definitive start date, they have a definitive end date, and it's seemingly everyone achieves a certain look in that time frame, when realistically we just know that's not possible, because it depends on someone's history, it depends on their genetics, it depends on their start point, it depends on, essentially it's down to a case of people losing body fat, which is, when people talk about I want that toned appearance, it's just more visible muscle on display. It's not necessarily that adding lots of muscle in that time, because fat loss from a physiological level is relatively simple compared to the muscle gaining process, which is much more lengthy and actually takes a lot longer and a lot more patience than people are willing to give. So I think, initially I'll always have a conversation about expectations, and I guess probably less so these days because of, I guess, my messaging, and also from a point of, I think, an important note of self-preservation, because I think wherever I've experienced negative body image over the years, it's probably being in a larger body when I was younger and being judged quite a lot based on my appearance and everything. All the negative connotations around that is a kind of self-aware as I thought I might have been in my early 20s. I kind of gravitated towards physique sport, which subjected myself to the opinions on strangers based on my appearance.
Even more so.
Even more so. And on the stage as well, which never sat comfortably with me, but I pursued with it. And a topic we're going to get onto is because when my industry is still fairly in its infancy, so it's often a case of monkey see, monkey do. So the authorities, I guess, the people with professional influence, which is always what I was aspiring to have, is that professional influence.
Yes.
And that people kind of bought into what you had to say over how you looked, was they also looked a certain way. They built a following based on a certain physique, and it was almost an expectation that you should look a certain way. And I think a lot of fitness professionals, especially listening to this now, will probably come across that. Is I'll often get asked is, do I think fitness professionals should look a certain way? So
and do you feel that people still look at you now as almost like an advert for your own like services? Do you know what I mean? Like, are they judging you, do you think?
I think they probably are. Yeah, I think judgment sometimes, I'd be interested to get your thoughts on this, is sometimes get us a bit of a bad rap, in that it's as a matter of like assessment and danger assessment and whether this person's trustworthy. We do just naturally judge people based on their appearance. It's something inherent, it's built in, we can't really avoid it. But then there's vocalizing that and the biases in which we build up a picture of that person. So I think people possibly do. And I just accept that, rather than possibly when I first started coaching people 13 plus years ago, 17 years I've been coaching people now, is that was a large part of my, I guess, my preoccupation with myself, was this person is judging me based on my appearance. I must look a certain way. Whereas I'm no longer there. It's, certain things that I do, but it's not, I'm not going to say that vanity doesn't come into it at all, because I think everyone's affected to that to a certain degree, but it's not the driving factor.
No. And I think there are some more personal trainers and coaches now on social media who have, you know, a range of body shapes and sizes,
Thankfully, yes. Yeah, totally.
which is, I think, good to see. I think it's interesting, isn't it, when as a professional you are judged by your own appearance. So I don't think it's very likely I'm going to be judged for my physique in the sector I'm in, but working in a dermatology clinic, I think it's understandable and natural that the people I see will probably have a quick look at my skin, because they'll be thinking, well, you know, you work with dermatologists, in theory you should know what you're doing, you know. And that's quite tricky because, I mean, I have, you know, a couple of chronic skin conditions, and some skin conditions aren't really quote unquote fixable. They're more kind of chronic. So that, you know, acne I've got that comes and goes, rosacea gets triggered. Some days it's okay, some days it's, you know, really quite unpleasant. And I think it's unhelpful if we think that, you know, professionals actually aren't human too. And we're all on a journey. And, you know, I think that I hope it means that I have a better understanding of where people are. And I've come to a place with my own skin that I've accepted that I'm not going to be ever able to get it back to an image I have in my mind, which was really a pre-pubescent image. And this is what a lot of people do. They have this image of, oh, when my skin was clear, you know, if only I could get it back to that. Well, that was you know, it's not physically possible. But what you could do is, you know, maybe have some treatments that help you feel more confident in your skin. But I think we all have this, even if we've done work on ourselves, we still, a little bit of us is chasing perfection.
Yeah.
And I'm wondering if that's the same with your industry. Like, I know you've kind of come on a real journey yourself.
Yeah.
But we still have these niggling like little bits like, oh, if only,
Yeah, and
you
I
know.
certainly see parallels there, especially when you mentioned, you know, treatments, and I'm thinking more towards the people that approach me regarding coaching, and it's, oh, look, I used to look this, I was this weight at this age, and
Yes, and
you
trying
know,
to get
the
back to
most,
that
yeah,
point in time. Yeah.
there's little acknowledgement that actually our bodies change over the years and everything else that comes with it. But there's certainly, I think there is, I don't want to condense it into there are no body image improvals with some people that, you know, want to physically embark on changing their bodies. But certainly the research I've looked at and what I've found anecdotally working with people is the closer they get to that body ideal, which is where what you said to me about the perfectionism resonates, is the quicker those goalposts move. So although they have this preconceived idea in their head, the closer they get to actually embodying that version of themselves, it actually almost like the reverse bell curve effect in that their body image worsens.
Yeah. It's so elusive, isn't it? And I think that's when people just need to be careful what their original expectations were, and if they were achievable, and what the rationale is to keep going. You know, if you've got to sometimes I talk about the idea of being good enough as opposed to trying to be perfect, and that a lot of people I work with do have perfectionist tendencies. It goes hand in hand with being quite conscientious, women especially, very thoughtful, hardworking, trying to be their best selves. But it's a bit of a slippery slope because you will never be able to achieve perfection. And trying to achieve perfection in how your body looks and how your skin looks and how you present yourself, it's a thankless task, and it isn't going to lead to happiness. And like you say, the more time you invest in it, what tends to happen is people's energy for other stuff drops away. You know, if you're having to spend more time at the gym and prepping meals and going for treatments and doing all these beauty routines, and routines get longer and longer, the makeup takes longer and longer, the self-care kind of goes past the point where it's actually, is it really self-care if it's taking up so much of your day, and you're then thinking about your appearance, and you're perhaps having to check your appearance and check in the mirror, oh, should I check? Then people kind of fall down this sort of slippery slope of the appearance concerns just become all consuming. And then you kind of get into the domain of, you know, real impact on people's mental health. Like they'll be feeling extremely anxious, they could be feeling panicky, they could be feeling very low and depressed. They could develop disordered eating. They could develop such a distorted image of themselves that it could fall within body dysmorphic disorder. Now, I'm not saying that's going to happen, that doesn't happen to everyone. There's a kind of continuum, but I think it's helpful for people to have conversations with their coaches. And when would I know how would I know where to stop? I guess that's the thing. And what would be good enough for me? And what is it that the image I have in my mind that I'm trying to chase, is that actually not realistic? And it sounds like that's a conversation that you need to have with people yourself, around expectations.
Yeah, I think there's actually, if you don't mind me saying, I think that's possibly from a self-awareness standpoint, a lot of conversation a lot of coaches need to have with themselves.
Yeah.
Because often the message that they send, and there's this incongruence almost, like they're talking about body image, but then if they're constantly doing physique updates on their social media feed and everything is a picture of them essentially in very little clothing, and they feel they have to maintain a certain appearance, there's almost, it doesn't align with the message that they're sending their clients and the people that work with them. But also, I just wondered your thoughts on the implications to the people that they're working with that incongruence, in that if you're highlighting the fact that people are more than their bodies,
Yeah.
by using your body.
I think you're right. I think it may look, people may look for different things in a personal trainer or coach. Some people may look towards someone who has a certain lifestyle and physique that they find aspirational. Maybe that's motivating. I think, I would suspect though, for quite a few people, they're looking for someone who has a common set of values. So if you are a trainer who, like you say, talks about, body acceptance, body positivity, anti-diet culture, you're absolutely right. If your marketing has, skimpy fitness stuff, then it is inconsistent. And I think people will question whether you are truly living in line with the values and what you're preaching. So I think it's a good question to ask, and I'm sure people pick up on it.
Yeah, I
Potential
think so.
clients.
I think we have that subconscious almost BS
Yeah,
monitor sometimes that we can see.
absolutely.
Even if we can't put our finger on it, just something, just that inner discernment just doesn't sit
Yeah.
right. But if you,
Especially now, like body positivity, it's become a thing that a lot of companies have jumped on this bandwagon. Same with skin positivity. Oh, this is like the thing to say. We better say it. But they're still pushing diet culture.
yeah, absolutely, and that is a foundation of it. And there is a huge element of, which always, I reflect back on, and I think I have been a participant. I have been an enabler to a certain degree, and I think a lot of my peers are. Like, I don't mean that as from a point of judgment, more just as a matter of fact, in which we feed into that narrative where we capitalize on people's discomfort, and we do largely base it on manipulating their psychology to a certain degree. I don't think I do that these days. I try to be as self-aware with that as I can. I've hugely changed my messaging over the years, and I kind of reflect back, and that was my best at that time to my understanding, and largely everyone else was doing. But I wanted to kind of address your point on you saying about women's bodies, especially, and the larger social cultural elements to that. And it goes without saying that the impossible standards women have had placed on their bodies goes back way further than men have even started. But I think the first course is like the 16th century.
People have written books on this. Yeah.
And
Yeah.
just how much that has changed. I don't even want to say evolved from every incarnation of it slightly different. For men, it tends to be more linear. It tends to be
Yeah.
they're more jacked and they're leaner, but they're always muscular. Like
Yeah.
that's I guess, the male ideal. But for women, there's been periods where it's, I guess, like skinny 90s Kate Moss.
Oh, it oscillates wildly. I mean, Kim Kardashian somehow, manages to change her body shape radically, and for some reason, the press still follow it, and she still
Yeah.
sets trends.
I think you say
Um,
somehow. I think you really know.
sorry.
I said you said somehow there, but I said I
Well, they do know.
really
They're
know.
complicit in it,
Yeah.
aren't they?
Yeah,
Yeah.
that's a really interesting thing, and I just wonder with that and what people are subjected to on social media, we're with this subconscious programming for so much of our lives, from the point that, talking about sticking 5-year-olds on scales these days, to what they're exposed to in the media,
Yeah.
to just common phrases and names and children being unkind and how they might hear their parents refer to other children, other adults. So just it's kind of impossible to get away from. So I guess
Yeah.
what do you feel people should have an awareness of so they can curate not only their feeds but cultivate this sense of informed thinking where it's they maintain a
Mm.
healthy level of skepticism when they're consuming this stuff?
I think we all can practice healthy skepticism when we're opening, beauty magazines, fitness magazines, when we're on social media. I think we can try and take a pause and try and see it in the bigger picture. It's almost like putting on different sunglasses.
Mm.
Can I see this from the perspective of someone who's older, who's younger, who lives in a different country, who's brought up in a different context? And it will help you see that actually what you're being presented with is socially constructed.
Mm.
It's pretty arbitrary what these standards are. They shift, from year to year. Lip filler wasn't a thing a couple of years ago, and I'm sure pretty soon it'll be something else. Already celebrities are having it removed. So we get pushed trends, but when we're in the middle of a trend, it feels all consuming. And because we are social creatures and we naturally compare ourselves to others, and we know that adolescents are particularly kind of hardwired to compare themselves to their peers. So if all your friends are doing a certain, diet, or going for a certain cosmetic procedure, or dressing a certain way, you'll feel under pressure to fit in with that group. So it's really hard, I think. So that's why I'm also a bit aware that as an adult, it's all very well for me being like, don't care what people think, don't, go with the flow. I think for some people it's super hard.
Mm.
But I would say just also think who you're surrounding yourself with, because we can choose our friends and we can choose who to spend time with. And if you're surrounding yourself with people whose values are different to yours, that I think is particularly damaging to our well-being. So if we've got lots of people around us who are perhaps quite focused on achieving certain aesthetic look, it's very hard to escape that. And you're going to get comments, and you're going to be comparing yourself. So I'd say think who's around you, and is that really what you're interested in? And is that a good dynamic?
Mm.
Because we will pick up on those vibes. I've got friends who I don't think they've ever been for a facial, or they've never seen a dermatologist. They're perhaps a little bit too chilled with what they just throw on in the morning. There's definitely, I think, a spectrum of people who are perhaps more interested in their appearance, and it's not there's no judgment, because a lot of people really enjoy spending time putting together like a really stylish outfit. It's very aesthetically pleasing, it's artistic, it's expressive. There's no criticism there. But I think some people who are in more aesthetically focused industries like fashion, maybe your industry, there's pros and cons of being in that space. It can become a bit of a bubble where we start comparing ourselves to a very small subgroup of people, and we can't see the bigger picture. So I think that's how people get a bit caught up with, well, I better do this, this cosmetic procedure because everyone else seems to have done it. And they've not quite realized that that's actually a bit of an artificially constructed pressure. Where's that actually come from? It's become self-fulfilling.
Mm.
So I think just anything we can do to give ourselves a pause and step back and say, right, where's this idea come from? Who's constructed this, but also who's benefiting from it? Who's making money off feeding into my anxiety and tapping into my anxiety? Who's making money from me feeling bad about myself?
Mm. Yeah, I often wonder about what the net effect of it is, because there's seemingly, oh well, there's so many other people do it, I'll just participate in that as well. But when everyone has that attitude, and straight away when you was talking about peer circles and children, I was thinking actually adults and other coaches and the I guess the support that you surround yourself with and what you
Yep.
expose yourself to, because again that comes from a place of self-awareness. And I
Yep.
think that no matter how self-aware we think we are, sometimes is we all have blind spots, especially when there's certain I guess, social media etiquette in which you'll follow people out of politeness. You maybe won't put them on mute or anything like that. But there's also a huge individuality in terms of what affects someone significantly with their negative body image might be perfectly fine with another person.
Yeah.
Even if they're not experiencing positive body, it just might be an indifference. They just don't really pick up on
Exactly.
it.
And I think we have a duty to look out for each other. So I think, again, that self-awareness is curiously lacking in an age where we're currently obsessed with self-disclosure. So you see this with a lot of the celebrities. It seems that everyone these days is doing a documentary about their mental health. I just saw that Ed Sheeran's just releasing one. Now, there's pros and cons of that. You know, people have done fantastic work raising awareness of mental health and normalizing it and reducing stigma. I think the trouble is that we've got a bit of a trend now of this sort of self-disclosure and spilling your trauma is the thing you need to do to show that you're authentic and relatable. Uh, but people, I think, don't pause to think, is this really something I want to do? And is this something I'm going to regret 5, 10, 20 years down the line? But also, what is the impact on my friends, on other people with this content that I'm putting out there? I think we do things that we think is good for us, but we're not necessarily aware that the content we're putting out could be very triggering for someone else who's in a very vulnerable place. So I think we just need to be a little bit more mindful. It's always good to practice.
Yeah.
Yeah, just tuning in. I think before we post anything, like, who's this really for? And you know, could this be harmful? Could this be triggering? Do I need to put like a trigger warning, or maybe just not post it?
Yeah, there's definitely responsibility all round. There's that awareness of, what negatively affects you, but how that might negatively affect others. And I think I've heard that referred to as almost sad fishing. And I totally agree with you what you say in terms of reducing stigma
Yeah.
related to mental health. And it's great that the conversation, that narrative keeps going. But at the same time, it feels really crass to vocalize the observation out loud. But I do know, unfortunately, people do leverage that as an opportunity to gain a little social currency. Like, I know this will resonate with people. I know I'll get more followers out there if I share this story. And it's a tough one, isn't it? I think it's intent is definitely an important factor there. I think there are people that genuinely share things, whether that's from a place of loneliness, they're lacking connection in their life, or just they are that sort of person that are quite happy to share those things. It's almost like talk therapy out loud to yourself.
Yeah.
But then, as you say, there's that personal disclosure sometimes. And I think in the Insta sound bites, I've often seen it, lean into those uncomfortable feelings when actually you should lean into those uncomfortable feelings with with a health and mental health professional such as yourself. And it's probably not something you should do on your own, because there's that incredible capacity we have to preserve ourselves, our feelings, and maintain our well-being. And if we're publicly spewing our guts up, it might not be the best for us. And as you say, it might not be the best for the people around us.
No. And we also then lose control of that. We've put that out into the public domain. I don't even know if we owned, I mean, does Instagram own the videos before? We lose ownership of this stuff, of our most kind of, private stuff. And we've just put that out there for everyone to see. Certainly I've seen people tweeting when they're very unwell, and then they've been admitted to a hospital for their mental health, and you see people later saying, oh God, I didn't realize I posted that stuff, when I was very unwell or manic, deleted it. But it's hard, isn't it, to say to someone, just take a pause. But I think, friends, family, loved ones can help try and play a role in helping people to make wise decisions about what people choose to disclose on public spaces. And I think we forget, because social media feels weirdly intimate, and some people who perhaps feel, more anxious in social situations often feel more comfortable online, and interacting through, messaging. So it can feel weirdly intimate. But if you wouldn't stand on the street corner and shout what you're going to say to thousands of passing people, then don't think twice before you post it on social media.
Yeah, I wonder whether do you feel there's any positives, perhaps talking about that stuff from a place of scarring rather than when you're amidst it, I guess you've got the emotion and everything that's moving with that. Whereas, do you think there's a positives to sharing those experiences when it's in the past and people have been through their own journey of I don't know whether healing or your thoughts on healing or healed or what the correct term would be. I guess healing. I don't know whether I believe in healed, but that's possibly due to
Mm. Well, look, I
how to
think
reflect on this,
anything
share that.
that anything that normalizes the journey, and helps to break down these myths that, we're all like drinking green smoothies and, going to the gym, for hours every day and living this perfect lifestyle. Um, I think that's good to normalize. Um, it's just getting the balance right, I think, and I think we're not currently at that stage. I think we sort of go through these trends, don't we, where we sort of swing a bit too far, and then maybe we'll get the balance right eventually. But at the moment, I think we're not quite using social media in the best way for our own well-being. I've got colleagues who've written about this sort of very tricky issue of how we increase awareness of mental health without giving people the impression that they've all got mental illness. And it's super, super hard to get this right because, we don't want people to feel their distress isn't valid in any way. But some people are sort of identifying with psychiatric disorders when that's not the case. Like I say, I think we've got a way to go on how we talk about mental health. I think at the moment the language is very kind of medicalized. We talk in the language of disorder. So how can we help the people who perhaps do have a mental health disorder and do need help and encouragement to sort of reach out for help, and they need to be given professional support, without giving the message to people who are perhaps a little bit anxious about their health or feeling a bit lonely or a bit different, giving them the message that there's something, seriously wrong with their mental health when that isn't the case. Maybe there's lots of ways of understanding ourselves. I think we talk about mental health, but I think we should talk more broadly about social identity and community. I think a lot of people just feeling lonely and not understanding their place in the world, we would be better placed to support people to link in with their local communities. And actually the sort of feelings that maybe they're describing in the language of mental health disorder actually may better kind of make more sense when they kind of feel a bit more connected, and actually they kind of get their well-being from thinking more holistically. So I don't know, I'm sure you've got thoughts on this, but a lot of like all the youth programs in the UK got scrapped with austerity. There were lots of, youth clubs. Unfortunately, a lot of those got scrapped. I'm really interested in using sport to engage with young people who are perhaps on the risk of kind of entering like the criminal justice system, and kind of getting them super early and kind of intervening and like giving young people mentors. And I think sport is the way we need to do this. But you'll probably know about this. I feel like a lot of the funding got pulled.
Yeah, a lot of the school sports partnerships funding was many, many years ago because I did a spell when I relocated back to Essex, actually working in school sports partnerships, and that's actually put on the competitions for primary and secondary schools. And they were going through a transition at a time where nationally they lost a lot of funding, and then the funding that was going directly to school sports partnerships to fund those activities. So it meant that even in the most socioeconomically deprived areas, those children were still getting access to after school clubs, they're still getting access to
Yeah.
competitions and something, even if they didn't have access to open fields locally, there would be funding in place to put them in a minibus and drive them to somewhere and things like that.
Yeah.
And then that got changed and the funding by the way, this might have changed, so if someone's listening to know better, but at that time it was given directly to the schools, and this is when schools were going through that transition of becoming academies. They became accountable to less people. So what they would then do with that funding was down to them to a certain degree, but the means in which they kept track of those things was essentially just a tick form. So if they said they spent £20,000 on teaching kids to cycle, then that's exactly what they spent it on, whether they spent it on that
Yeah.
or not. And I'm certainly not implying that any schools did that, but essentially that it was like that loose in terms of the management. But when we look at, and you know, something you must come across all the time, we're looking at the cost of living, we're talking about nourishing young minds and how developing minds, especially at a young age, it's so important that they are nourished with the right nutrients and they have access to school dinners, they have access to breakfast. And we look at access to facilities, fields, after school clubs. It's a minefield, isn't it? And I think, you know, that could take us off on another tangent, perhaps
Yeah.
another time. But
that was making me think about people for whom it's hard to access green spaces, but perhaps need it most are people who are very unwell with their mental health. So, you know, people who may need to be admitted to a hospital because they're unwell. I wanted your thoughts on this. I mean, I found it fascinating. So I've worked in a couple of those psychiatric hospitals, and generally because of kind of people's mental health state, their ability to leave is restricted. As they get better, they gradually get given, you know, leave, and then eventually overnight leave, and then they'll be discharged. But the whole nature of being admitted is that your physical movement is restricted. And then what tends to happen is if people are very unwell, they tend to get put on lots of psychiatric medications that unfortunately a side effect can be weight gain. So it's very common for inpatients to gain quite a bit of weight and become very sedentary. And yet there isn't exercise programs. They don't get to kind of get outside in the fresh air. Often there's like a tiny, tiny garden, and then access is quite tightly controlled. I've worked in hospitals where like they would often have a physiotherapist, like they might have a small gym, but is pretty limited access, unfortunately. And like you might get a group Tai Chi class or something quite gentle. But it always surprised me. I think, why are we not thinking about the physical health? Why are we just treating the mental health? It just seems to be it needs to be joined up, right?
yeah,
The
and
system can't do it.
vice versa, I would have to say as well, because I see often in the fitness space people say the gym's my therapy. Well, I mean, it might be therapeutic in the way in which you use it, or for some people, the way they rely on it as a control variable in their life. But it's not therapy per se, is it?
Yeah.
You know, arguably people could do with the two, but then it's means, it's access, and I think with health and fitness and mental health services are so closely aligned, and there's so much overlap, which is why I try and, I guess, reach out to medical professionals such as yourself that are doing clinical work, because there is so much overlap. There's so many ways in which both could benefit each other, but there's funding, there's access, and the difficulty, I guess, and the biggest difference, I guess, that we have, or I have in the health and fitness space, is often people actively find me if they feel they need help, you know, and that's if they have the means, because it's actually private sector, whereas the NHS are in a position where they would love to help more, but they just don't have the funding, they don't have the staff, and there's all these other factors. And I know people get disgruntled. Some people have magnificent experiences, others less so. So it's so hard. And you know, I think it's good to talk about these things, not necessarily to present answers, but just to talk about how complex they are, how multifaceted, like how many variables are involved. So it's not as simple as, well, that person's struggling with their mental health, let's just give them after school football for 10 weeks to do, because there's other psychology involved. And I think, again, when I was working with the schools, is we'd often apply for funding pots for adults as well. We'd be putting on exercise for adults, and it would be one school I was working in particular. I was working as a partnership development manager at the time, and the hub, the school sports partnership hub, was based at that school, and we'd secured £10,000 for a boot camp for all the teachers of that school, and it would be at 3:30 twice a week for however many weeks we worked out. But £10,000, which, you know, to pay an external agent to come in and deliver that on school premises, so literally they would just have to go get changed. It was after school hours, literally half hour after the bell went, and it was there. And it was 10 people first occasion, then 9, then 5, then 2, then none, to the point that the money had to be given back. So I think there's another factor too. Sometimes people disregard free stuff, even.
I think there's an interesting psychology to that.
Mm.
Yeah, I believe, I mean, it's a separate thing, but I think there are some countries where they've been trialing charging for like a minimum fee for some public health services, just to it gives a little bit of an incentive.
Mm.
Obviously that's controversial, because some people can't afford anything, and would be very grateful to go. But certainly I've had people who don't show up, and there's no reason, there's no reasonable
Yeah.
excuse why, and I could have seen someone else in that time. It happens a lot, unfortunately, in the NHS. Yeah, it's a tricky one.
Mm. I'm thinking like broader as well within like mental health implications, and if you don't mind me saying, like the global burden, if that's the correct phrasing, and
Mm.
diagnosis largely, is that, do you feel that's, I know that there's been various incarnations of the DSM over the years, but that's been more mental health concerns identified and becoming better at diagnosing those things? Or do you think the self-diagnosis part has had a huge implication for the global burden increasing?
Oh, it's so difficult to unpick, because, like you've kind of hinted, there's so many social and cultural
By
factors.
the way, could I just apologise because you told me we had to wrap up soon. I've just thrown you a whopper
No, well,
right at the end there.
that
So
is a chunky old question. So we should say for people, the DSM, Diagnostic Statistical Manual, is the kind of Bible of psychiatric diagnoses. There is another one, the ICD, which is used in Europe. But anyway, it gets bigger and bigger every year. And there are people who've written books on the changing definitions of mental health. So each edition of the DSM, currently the 5th edition, the stuff that's in there is different.
mm,
The names change, the way they're categorized change, they add in things, they take out things. It just goes to show that the idea of mental illness is socially constructed.
yeah.
Um,
Well,
yeah.
it was the DSM-3, which was 1970-ish, that homosexuality was still considered a mental illness.
Well,
And
yeah, so there you go.
that
Yeah,
wasn't that long ago.
yeah, yeah.
So that, it's interesting that
So
that.
we're constantly moving the bar.
Mm.
And yes, we are increasing awareness. So now, and also we're increasing, hopefully, access to assessments. So maybe people are getting diagnosed that previously weren't even getting into services. But maybe there are some people who are overly identifying with mental health problems, where maybe their problems are milder or more transient, or are kind of focusing more on that, where maybe their distress can be better explained by, like I said, sort of social isolation or other factors. We know that the social determinants of mental health are massive. Poverty and deprivation, financial instability, and we're at such a tough time right now. So
It's
yeah.
encouraging our dialect as well, isn't it? People will often say I'm OCD without obviously being diagnosed with obsessive compulsive disorder, or
Mm.
I have anxiety, when they're just feeling angst or nerves, or I'm feeling
Yeah, I think it's a phase.
ADHD is another one. I feel like
It's a
people.
phase we're going through, I think, as we are trying to reduce stigma. We're normalizing talking about mental health problems. That's great, but we've kind of overly appropriated this discourse. And the problem of that, unfortunately, is that we re-stigmatize, and we kind of take away from the experiences of people who are very unwell. I've worked with people with OCD. OCD is not wanting to just line up your jars in your pantry and clean your sink. It's a debilitating condition. People don't want to be doing the things they're doing. That's why they're called compulsions. They're very distressing. So kind of confusing fastidiousness with OCD is not helping anybody. It's not helping the person who's labeling themselves as OCD incorrectly. And it's certainly not helping the people who have got OCD, who just want people to actually listen and understand the impact on them. So like I say, I think it's the phase we're at. I think we're on a journey. So the way we kind of think about and talk about mental health, we've got a way to go.
Yeah, I guess it almost becomes trivialized, and the people that are going through the deepest, darkest depths of it, perhaps feel they can't speak about it because they're being
Exactly. You know, they're feeling undermined and not feeling heard. We're not good at thinking about serious mental illness.
yeah,
You know,
it's not.
bipolar disorder, psychosis. We very rarely talk about it because the truth is, it is still largely, unfortunately, quite stigmatized, and it's not. You know, it doesn't fit with stuff that's kind of easily talked about on
Yeah,
TikTok.
it's not cool, is it? Not
It's
that it should
not.
be cool, but it's interesting to me because I always think we're quick to talk happy, clappy mental health, meditate, get out in nature, drink your water, get out in sunlight. But when it comes to debilitating mental illness, it's
Mm,
bloody uncomfortable.
mm,
And actually, if they were to understand, as you mentioned, what people with psychosis or personality disorder and all these other things are
yeah.
experiencing, they probably wouldn't want to talk about it because there is that.
I think, you know, we perhaps just need to think about, are we, you know, I think the word mental health as well is being overused. Sometimes it's more helpful to talk about well-being, emotional well-being, mental well-being. But yeah, I think people associate now mental health with mental health problems, mental health disorder.
Yes.
So it's always a good check just to substitute mental for physical. So are you talking about mental health in the same way you talk about physical health? Usually people use it in weird ways.
Mm,
So that's
yeah.
a good test.
That's a really interesting point, actually, and I think we are going to wrap up there because leave
Yes.
to ponder that one and have a little think about. Just before you go, obviously, I think it goes without saying, I very much appreciate you. I appreciate your time. Thank you so much for giving a segment of that up
You're
for us.
welcome.
If someone somewhere listening to this right now wanted to go, or watching this wanted to go find out a little bit more about you, what you do, how you help people, where would you send them, Eleanor?
Oh, thanks, Dan. Yeah, so I am on Instagram. It's pretty new. I've just been starting out. So yeah, I'm on Instagram at Dr. Eleanor Chatburn, and I'm kind of mainly making content about body image, skin conditions, and I do stray sometimes into having a bit of rant about social media and mental health. So
Don't we all?
feel free to connect with me over there.
Yeah, thank you very much. And it goes without saying, if you really enjoyed Eleanor's words of wisdom, please do go check her out. And if you could politely leave a rating on this if you've enjoyed it and share it with a friend. Thanks so much, Eleanor. I will speak to you soon.
Thanks. Bye.